Hey everyone, today I want to talk about an interesting case that came into our office. This is a 65-year-old male who presented with neck and upper back pain. He's actually a long-standing patient who's been here for a number of different things, and this started to flare up, so he decided to come back in and have us take a look at it. We did an examination, normal motor reflex and sensory palpation. We noticed a lot of stiffness and tightness in his neck, and that was his primary complaint. But most of his exam findings were pretty straightforward. Nothing really jumped out at us. Because of his age and his predilection, and just because we felt like it was appropriate, we took an x-ray, and this is what we came up with. So what we're looking at here is a cervical spine. This is the front. Obviously, this is the back. So this is the first, second, third, fourth, fifth, sixth, and the seventh cervical vertebra right here. When we take these pictures, we want to look at the size and the shape of the bones. We want to make sure everything's kind of where it's supposed to be. And we go through a series of steps in order to determine what's going on in a radiographic image. One of the things we noticed immediately with this patient was what we call calcification of the anterior longitudinal ligament. So this is a disease known as Diffuse Idiopathic Skeletal Hyperostosis. It's a disease of the joints. It can be in the spine, also in extra-articular surfaces such as the shoulder and the knees, the hips. And what you have is a calcification of these soft tissue structures, which causes almost what we call a flowing hyperostosis, so these bones kind of melt one into the other. If you notice, the spaces between the bones actually stay intact. So your disc spaces stay somewhat intact, but what happens is the bones actually start to kind of melt one into the other. This is a disease which is predominantly in men more than women. This is the disease that affects roughly 10% of the population, and it's in people between the ages of 50 and 60 years old. Vertebral motion usually remains unaffected, but this gentleman did present with this neck and upper back pain issue, so we decided to treat it appropriately. What do we do at the Center for Spine Care Mobility for a patient like this? We put them on a normal care plan. We institute a combination of chiropractic and physical therapy twice a week for 6 weeks. Our job as the chiropractors is to kind of lengthen and kind of mobilize as much soft tissue structure as possible, with the physical therapists working on strengthening and stabilizing. We'll probably include a little bit of physical therapy, and if acupuncture or trigger point therapy is appropriate for any type of trigger point work or any kind of other soft tissue work, we can prescribe that as well. Stenosis is, as a side mark, stenosis is somewhat uncommon with these type of cases, so you don't have to worry about anything becoming compressed with regards to nerve structures. But one of the things you do want to pay attention to is whether or not the patient has trouble swallowing. So this is where the patient swallows, and sometimes this flowing hyperostosis can push up into this area. There's no reason why this patient with some conservative care can't respond well to therapy, and we look forward to treating them. If you have any questions, feel free to reach out to us at www.cscmgroup.com. Take care.